Hey Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 100 Practice NCLEX questions. Without the way, let's get started.
A client has a history of heart failure and has been taking furosemide Lasix, digoxin, lanoxin, and potassium chloride. The client has nausea, blurred vision, headache, and weakness. The nurse notes that the client is confused. The telemetry strip shows first-degree atrioventricular block. The nurse should assess the client for signs of which of the following? 1. Hyperkalemia. 2. Digoxin toxicity. 3. Fluid deficit. 4. Pulmonary edema. The correct answer is 2. Early symptoms of digoxin toxicity include anorexia, nausea, and vomiting. Visual disturbances can also occur, including double or blurred vision and visual halos. Hypokalemia is a common cause of digoxin toxicity associated with arrhythmias because low serum potassium can enhance ectopic pacemaker activity, although vomiting can lead to fluid deficit. Given the client's history, the vomiting is likely due to the adverse effects of digoxin toxicity. Pulmonary edema is manifested by dyspnea and coughing. The nurse is reconciling prescriptions for a client diagnosed recently with pulmonary tuberculosis who is being admitted to the hospital for a total hip replacement. The medication prescription sheet says isoniazid 300 mg PO daily, rifampin 600 mg PO daily, pyridoxine 10 mg PO daily, ethambutol 400 mg PO daily, and pyrazinamide 1.5 grams PO daily. The client asks if it is necessary to take all of these medications while in the hospital. The nurse should 1. Request that the healthcare provider review the prescriptions for a duplication between isoniazid and ethambutol. 2. Inform the client that all drugs will be discontinued until the client can eat solid foods. 3. Ask the pharmacist to check for drug interactions between the rifampin and isoniazid. 4. Tell the client that it is important to continue to take the medications because the combination of drugs prevents bacterial resistance. The correct answer is 4. The nurse should tell the client that it is necessary to take all of these medications because combination drug therapy prevents bacterial resistance. They will be administered throughout the hospitalization to maintain blood levels. The healthcare provider will review the prescriptions per a hospital policy because the client is being admitted to hospital. There is no duplication between any of the drugs being prescribed for this client. It is not necessary to ask the pharmacist to check for drug interactions, as these drugs are commonly used together. When asked about her stresses before admission, an anxious client stares blankly at the nurse and mutters unintelligibly. Which of the following descriptions of the client's behaviors should the nurse document in the client's chart? 1. Client cannot answer any questions asked at this time. 2. Client is uncooperative during the admission procedure, refusing to answer any questions. 3. Client responded to questions with a blank look and incomprehensible mumble. 4. Client stared at the wall when asked questions and was disoriented and incoherent. The correct answer is 3. The nurse must be objective in documenting the client's behavior, recording exactly what the client did or did not say or do in a particular situation. Recording that the client could not answer any questions, was uncooperative and refused to answer questions, or was disoriented and incoherent is not described and is a subjective interpretation on the nurse's part. The nurse teaches a client with heart failure to take oral furosemide in the morning. The primary reason for this is to help 1. Prevent electrolyte imbalances. 2. Slow rapid drug absorption. 3. Excrete excessive fluids accumulated during the night. 4. Prevent sleep disturbances during the night. The correct answer is 4. When diuretics are given early in the day, the client will void frequently during the daytime hours and will not need to void frequently during the night. Therefore, the client's sleep will not be disturbed. Taking furosemide in the morning has no effect on preventing electrolyte imbalances or slowing rapid drug absorption. The client should not accumulate excessive fluids throughout the night. A client with tuberculosis is taking isoniazid, INH, to help prevent development of peripheral neuropathies. The nurse should instruct the client to 1. Adhere to a low cholesterol diet. 2. Supplement the diet with pyridoxine. 3. Get extra rest. 4. Avoid excessive sun exposure. The correct answer is 2. INH competes for the available vitamin B6 in the body and leaves the client at risk for development of neuropathies related to vitamin deficiency. Supplemental vitamin B6 is routinely prescribed following a low cholesterol diet. Getting extra rest and avoiding excessive sun exposure will not prevent the development of peripheral neuropathies. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following is a priority goal for the client with chronic obstructive pulmonary disease? 1. Maintaining functional ability. 2. Minimizing chest pain. 3. Increasing carbon dioxide levels in the blood. 4. Treating infectious agents. The correct answer is 1. A priority goal for client with COPD is to manage the signs and symptoms of the disease process so as to maintain the client's functional ability. Chest pain is not a typical symptom of COPD. The carbon dioxide concentration in the blood is increased to an abnormal level in clients with COPD. It would not be a goal to increase the level further. Preventing infection would be a goal of care for the client with COPD. A client with aortic stenosis has increasing dyspnea and dizziness. Identify the area where the nurse would place the stethoscope to assess a murmur from aortic stenosis. Choose option 1, 2, 3, 4, or 5 from the picture. The correct answer is option 1. The stethoscope is placed at the second intercostal space right of sternum to assess the aortic area as seen in option 1. Option 2 is a pulmonic valve area. Option 3 is Erb's point. Option 4 is a tricuspid valve area. And option 5 is the mitral valve area. Discharge teaching for a 3-month-old infant with a cardiac defect who is to receive digoxin should include which of the following? Select all that apply. 1. Give the medication at regular intervals. 2. Mix the medication with a small volume of breast milk or formula. 3. Repeat the dose one time if the child vomits immediately after administration. 4. Notify the primary care provider of poor feeding or vomiting. 5. Make up any missed doses as soon as realized. 6. Notify the primary care provider if more than 2 consecutive doses are missed. The correct answers are 1, 4, and 6. To achieve optimal therapeutic levels, digoxin should be given at regular intervals without variation, usually every 12 hours. Vomiting and poor feeding are signs of toxicity. If more than 2 consecutive doses are missed, interventions may be needed to assure therapeutic drug levels. The medication should not be mixed with any other fluid, as refusal may result in inaccurate intake of the medication. Taking make-up doses or taking the medication at times other than scheduled may adversely affect serum levels. A 34-year-old female with a history of asthma is admitted to the emergency department. The nurse notes that the client is dyspneic, with a respiratory rate of 35 breaths per minute, nasal flaring, and use of accessory muscles. Auscultation of the lung fields reveals greatly diminished breath sounds. Based on these findings, which action should the nurse take to initiate care of the client? 1. Initiate oxygen therapy as prescribed and reassess the client in 10 minutes. 2. Draw blood for an arterial blood gas. 3. Encourage the client to relax and breathe slowly through the mouth. 4. Administer bronchodilators as prescribed. The correct answer is 4. In an acute asthma attack, diminished or absent breath sounds can be an ominous sign indicating lack of air movement in the lungs and impending respiratory failure. The client requires immediate intervention with inhaled bronchodilators, IV corticosteroids, and possibly IV theophylline. Administering oxygen and reassessing the client 10 minutes later would delay needed medical intervention, as with drawing blood for an arterial blood gas analysis. It would be futile to encourage the client to relax and breathe slowly without providing the necessary pharmacologic intervention. The nurse should teach the client who is receiving warfarin sodium that 1. Partial thromboplastin time. Values determine the dosage of warfarin sodium. 2. Protamine sulfate is used to reverse the effects of warfarin sodium. 3. International normalized ratio is used to assess effectiveness. 4. Warfarin sodium will facilitate clotting of the blood. The correct answer is 3. INR is a value used to assess effectiveness of the warfarin sodium therapy. Partial thromboplastin time is used to assess the effectiveness of heparin therapy. Fresh frozen plasma or vitamin K is used to reverse warfarin sodium's anticoagulant effect, whereas protamine sulfate reverses the effects of heparin. Warfarin sodium will help to prevent blood clots. After surgery to correct the tetralogy of Fallot, the child's parents express concern to the nurse that their 4-year-old child wants to be held more frequently than usual. The nurse recommends 1. Introducing a new skill. 2. Play therapy. 3. Encouraging behavior. 4. Having the volunteer hold the child. The correct answer is 2. The child is exhibiting regression. During periods of stress, children frequently revert to behaviors that were comforting in earlier developmental stages. Play therapy is one way to help the child cope with the stress. Teaching a new skill most likely would add more stress. Parents should be instructed to praise positive behaviors and ignore regressive behaviors rather than calling attention to them through encouragement or discouragement. Having someone else hold the child does not encourage coping with the stress or promoting appropriate development. Which of the following findings would most likely indicate the presence of a respiratory infection in a client with asthma? 1. Cough productive of yellow sputum. 2. Bilateral expiratory wheezing. 3. Chest tightness. 4. Respiratory rate of 30 breaths per minute. The correct answer is 1. A cough productive of yellow sputum is the most likely indicator of a respiratory infection. The other signs and symptoms, wheezing, chest tightness, and increased respiratory rate, are all findings associated with an asthma attack and do not necessarily mean an infection is present. What areas of education should the nurse provide employees in a factory making products that cause respiratory irritation to reduce the risk of laryngeal cancer? Select all that apply. 1. Stopping smoking. 2. Using a HEPA filter in the home. 3. Limiting alcohol intake. 4. Brushing teeth after every meal. 5. Avoiding raising the voice to be heard over the noise in a factory. The correct answers are 1 and 3. The primary risk factors for laryngeal cancer are smoking and alcohol intake. Smoking cessation is most successful with a support group or counseling. Heavy drinking should be avoided since the risk increases with the amount of alcohol consumption. HEPA filters help trap small particles and allergens to reduce allergy symptoms and asthma. Poor oral hygiene is not a risk factor, nor is overusing the voice. A 17-year-old client at 33 weeks gestation diagnosed with mild preeclampsia is treated as an outpatient. The nurse instructs the client to contact a healthcare provider immediately if she experiences which of the following? 1. Blurred vision. 2. Ankle edema. 3. Increased energy levels. 4. Mild backache. The correct answer is 1. Severe headache, visual disturbances, such as blurred vision, and epigastric pain are associated with the development of severe preeclampsia and possibly eclampsia. These danger signs and symptoms must be reported immediately. Severe headache and visual disturbances are related to severe vasoconstriction and a severe increase in blood pressure. Epigastric pain is related to hepatic dysfunction. Ankle edema is common during the 3rd trimester. However, facial edema is associated with increased fluid retention and the progression from mild to severe preeclampsia. Increased energy levels are not associated with the progression of the client's preeclampsia or the development of complications. In fact, some women report an energy spurt before the onset of labor. Mild backache is a common discomfort pregnancy, unrelated to progression of the client's preeclampsia. It also may be associated with bed rest when the mattress is not firm. Some multiparous women have reported a mild backache as a sign of impending labor. A child with Kawasaki disease is receiving low-dose aspirin. The mother calls a clinic and states that the child has been exposed to influenza. Which recommendations should the nurse make? Select all that apply. 1. Increase fluid intake. 2. Stop the aspirin. 3. Keep the child home from school. 4. Watch for fever. 5. Weigh the child daily. The correct answers are 2 and 4. Aspirin needs to be stopped because of its possible link to Reye's syndrome. Additionally, the parents need to watch for signs and symptoms of influenza. Children with influenza, frequently present with fever, cold symptoms, and gastrointestinal symptoms. Increasing the child's fluid intake and weighing the child daily are not needed at this time because the child is not ill. Keeping the child home from school is not necessary because the child is not ill and has already been exposed. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Penicillin has been prescribed for a client admitted to the hospital for treatment of pneumonia. Prior to administering the first dose of penicillin, the nurse should ask the client, 1. Do you have a history of seizures? 2. Do you have any cardiac history? 3. Have you had any recent infections? 4. Have you had a previous allergy to penicillin? The correct answer is 4. The nurse should determine if the client is allergic to penicillin prior to administering the drug. History of seizures, recent infections, and a cardiac history are not contraindications for this client for receiving penicillin. While it is important to know, recent infections will not preclude this client receiving penicillin at this time. Which of the following measures would most likely be successful in reducing pleuritic chest pain in a client with pneumonia? 1. Encourage the client to breathe shallowly. 2. Have the client practice abdominal breathing. 3. Offer the client incentive spirometry. 4. Teach the client to splint the rib cage when coughing. The correct answer is 4. The pleuritic pain is triggered by chest movement and is particularly severe during coughing. Splinting the chest wall will help reduce the discomfort of coughing. Deep breathing is essential to prevent further atelectasis. Abdominal breathing is not as effective in decreasing pleuritic chest pain as a splinting of the rib cage. Incentive spirometry facilitates effective deep breathing, but does not decrease pleuritic chest pain. Which of the following is an expected outcome for an elderly client following treatment for bacterial pneumonia? 1. A respiratory rate of 25 to 30 breaths per minute. 2. The ability to perform activities of daily living without dyspnea. 3. A maximum loss of 5 to 10 pounds of body weight. 4. Chest pain that is minimized by splinting the rib cage. The correct answer is 2. An expected outcome for a client recovering from pneumonia would be the ability to perform activities of daily living without experiencing dyspnea. A respiratory rate of 25 to 30 breaths per minute indicates the client is experiencing tachypnea, which would not be expected on recovery. A weight loss of 5 to 10 pounds is undesirable. The expected outcome would be to maintain normal weight. A client who is recovering from pneumonia should experience decreased or no chest pain. A nurse is teaching the parents of a preschooler about the possibility of postoperative hemorrhage after a tonsillectomy and adenoidectomy. The nurse should explain that the risk is greatest at which of the following times? 1. 1 to 3 days after surgery. 2. 4 to 6 days after surgery. 3. 7 to 10 days after surgery. 4. 11 to 14 days after surgery. The correct answer is 3. The risk of hemorrhage from a tonsillectomy is greatest when the tissue begins sloughing and the scabs fall off. This typically happens 7 to 10 days after a tonsillectomy. A toddler who has been treated for a foreign body aspiration begins to fuss and cry when the parents attempt to leave the hospital for an hour. The parents will be returning to take the toddler home. As the nurse tries to take the child out of the crib, the child pushes the nurse away. The nurse interprets this behavior as indicating separation anxiety, involving which of the following? 1. Protest. 2. Despair. 3. Regression. 4. Detachment. The correct answer is 1. Young children have specific reactions to separation and hospitalization. In the protest stage, the toddler physically and verbally attacks anyone who attempts to provide care. Here, the child is fussing and crying and visibly pushes the nurse away. In the despair stage, the toddler becomes withdrawn and obviously depressed. Regression is a return to a developmentally earlier phase because of stress or crisis. Denial or detachment occurs if the toddler's stay in the hospital without the parent is prolonged because the toddler settles into the hospital life and denies the parent's existence. A preemie gravida client has completed her first prenatal visit and blood work. Her laboratory test for the hepatitis B surface antigen is positive. The nurse can advise the client that the plan of care for this newborn will include which of the following? Select all that apply. 1. Hepatitis B immune globulin at birth. 2. Series of 3 hepatitis B vaccinations per recommended schedule. 3. Hepatitis B screening when born. 4. Isolation of infant during hospitalization. 5. Universal precautions for mother and infant. 6. Contraindication for breastfeeding. The correct answers are 1, 2, and 5. The test result indicates that the mother has an active hepatitis infection and is a carrier. Hepatitis B immune globulin at birth provides the infant with passive immunity against hepatitis B and serves as a prophylactic treatment. Additionally, the infant will be started on the vaccine series of 3 injections. The infant should not be screened or isolated because the infant is already hepatitis B positive. As with all clients, universal precautions should be used and are sufficient to prevent transmission of the virus. Women who are positive for hepatitis B surface antigen are able to breastfeed. After conducting a presentation to a group of adolescent parents on the topic of adolescent pregnancy, the nurse determines that one of the parents needs further instruction when the parent says that adolescents are at greater risk for which of the following? 1. Denial of the pregnancy. 2. Low birth weight infant. 3. Cephalopelvic disproportion. 4. Congenital anomalies. The correct answer is 4. Additional teaching is needed when the parent says that adolescents are at greater risk for congenital anomalies. Although adolescents are at greater risk for denial of the pregnancy, lack of prenatal care, low birth weight infant, cephalopelvic disproportion, anemia, and nutritional deficits, and have a higher maternal mortality rate, studies reveal that congenital anomalies are not more common in adolescent pregnancies. A multigravida client who stands for long periods while working in a factory visits the prenatal clinic at 35 weeks gestation, stating, "The varicose veins in my legs have really been bothering me lately. Which of the following instructions would be helpful? 1. Perform slow contraction and relaxation of the feet and ankles twice daily. 2. Take frequent rest periods with the legs elevated above the hips. 3. Avoid support holes that reach above the leg varicosities. 4. Take a leave of absence from your job to avoid prolonged standing." The correct answer is 2. The client with leg varicosities should take frequent rest periods with the legs elevated above the hips to promote venous circulation. The client should avoid constrictive clothing, but support hose that reach above the varicosities may help alleviate the pain. Contracting and relaxing the feet and ankles twice daily is not helpful because it does not promote circulation. Taking a leave of absence from work may not be possible because of economic reasons. The client should try to rest with her legs elevated or walk around for a few minutes every 2 hours while on the job. A young woman comes to the mental health clinic for her routine medication follow-up. She has been married for 2 years and reports that she and her husband are ready to start a family. She has a diagnosis of bipolar 1 disorder and has been well managed on D-valproic sodium Depakote for at least 3 years. What is the most essential counsel for the nurse to give her? 1. Schedule an appointment for a complete gynecological exam if you have not had one in the past year. 2. Pay careful attention to eating healthy from this point on in order to maximize the health of both mother and baby. 3. Check with your prescriber today, as Depakote carries an increased risk for birth defects, especially during the first 3 months of pregnancy. 4. It is very important for you to take steps to reduce your stress, and this will help you to stay in balance during your pregnancy and reduce your chances of developing postpartum depression. The correct answer is 3. All of these options need to be addressed. However, it is vital that this young woman receive counseling about the serious birth defects that have an increased incidence with the taking of Depakote during the first trimester of pregnancy. These problems include craniofacial abnormalities, organ malformations, limb deficiencies, and developmental delays. The chances of preeclampsia and premature labor are also increased. A client states to a nurse, "Hey, sweetie, you're looking good today." Which of the following responses by the nurse is best? 1. Thank you for being so kind and thoughtful. 2. I know you are only teasing me. 3. My name is Molly, and I am a nurse on a unit today. 4. I am not here to receive compliments from clients. The correct answer is 3. The nurse states her identity and purpose for being on the unit to clarify any misperception by the client. Thank you for being so kind. I know you are only teasing me, and I am not here to receive compliment from clients are non-therapeutic statements and do not clarify the nurse's identity and purpose. The nurse is reviewing the history and physical and physician prescriptions on a chart of a newly admitted client. The chart reads, 19-year-old reports a constant cough for the past few weeks with dark sputum for the past few days. Has night sweats, 10 pounds weight loss in the past month, and always being tired. He took 1 Tylenol about an hour prior to arrival. BP is 120/64. Heart rate is 84 with regular rhythm. Respiration is 26, unlabored. Slight wheezing in right lower lobe posteriorly. Oxygen saturation is 92%. Temperature is 99.9 degrees Fahrenheit orally. Skin is warm and slightly diaphoretic. The patient has non-productive cough at this time. Nursing assessment reveals possible respiratory infection. The HCP orders chest X-ray, sputum specimen, and oxygen at 2 liters per nasal cannula. The nurse should first 1. Initiate airborne precautions. 2. Apply oxygen at 2 liters per nasal cannula. 3. Collect a sputum sample. 4. Reassess vital signs. The correct answer is 1. There is a high risk and potential for tuberculosis, and airborne precautions should be implemented immediately to prevent the spread of infection. After initiating precautions, the nurse can start the oxygen, check the vital signs, and collect the sputum specimen. A client diagnosed with schizophrenia is being switched to risperidone long-acting injection, which is Risperdal Consta. He is told that he will remain on his oral dose of risperidone daily for approximately 1 month. The client says, I didn't have to take pills when I was on flufenazine decanoate shots in the past. The nurse should tell the client, 1. Taking flufenazine orally and by injection would not be as effective as the injection alone. 2. Risperdal Consta is less potent than flufenazine decanoate. 3. The doctor didn't believe you would take both the pills and flufenazine decanoate. 4. Risperdal Consta initially takes a little longer to reach the ideal blood level. The correct answer is 4. Achieving a therapeutic blood level is a slower process with risperidone long-acting injection. Oral flufenazine does not decrease the effectiveness of the intramuscular version and might increase the incidence of adverse effects. There is no evidence that the potency of the 2 medications is significantly different. Blaming the client for noncompliance with these 2 medications is inappropriate. The major goal of nursing care for a client with heart failure and pulmonary edema is to 1. Increase cardiac output. 2. Improve respiratory status. 3. Decrease peripheral edema. 4. Enhance comfort. The correct answer is 1. Increasing cardiac output is the main goal of therapy for the client with heart failure or pulmonary edema. Pulmonary edema is an acute medical emergency requiring immediate intervention. Respiratory status and comfort will be improved when cardiac output increases to an acceptable level. Peripheral edema is not typically associated with pulmonary edema. Which of the following family members exposed to tuberculosis would be at highest risk for contracting the disease? 1. 45-year-old mother. 2. 17-year-old daughter. 3. 8-year-old son. 4. 76-year-old grandmother. The correct answer is 4. Elderly persons are believed to be at higher risk for contracting tuberculosis because of decreased immunocompetence. Other high-risk populations in the United States and Canada include the urban poor, clients with acquired immunodeficiency syndrome, and minority groups. Which of the following physical assessment findings are normal for a client with advanced chronic obstructive pulmonary disease? 1. Increased anteroposterior chest diameter. 2. Underdeveloped neck muscles. 3. Collapsed neck veins. 4. Increased chest excursions with respiration. The correct answer is 1. Increased anteroposterior chest diameter is characteristic of advanced COPD. Air is trapped in the overextended alveoli, and the ribs are fixed in an inspiratory position. The result is the typical barrel-chested appearance. Overly developed, not underdeveloped, neck muscles are associated with COPD because of their increased use in the work of breathing. Distended, not collapsed, neck veins are associated with COPD as a symptom of the heart failure that the client may experience secondary to the increased workload on the heart to pump blood into the pulmonary vasculature. Diminished, not increased, chest excursion is associated with COPD. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse's discharge teaching plan for the client with heart failure should emphasize the importance of doing which of the following? 1. Maintaining a high-fiber diet. 2. Walking 2 miles every day. 3. Obtaining daily weights at the same time each day. 4. Remaining sedentary for most of the day. The correct answer is 3. Instructing the client to obtain daily weights at the same time each day is very important. The client should be told to call the physician if there has been a weight gain of 2 pounds or more. This may indicate fluid overload, and treatment can be prescribed early and on an outpatient basis, rather than waiting until the symptoms become life-threatening. Following a high-fiber diet is beneficial, but it is not relevant to the teaching needs of the client with heart failure. Prescribing an exercise program for the client, such as walking 2 miles every day, would not be appropriate at discharge. The client's exercise program would need to be planned in consultation with the physician and based on the history and the physical condition of the client. The client may require exercise tolerance testing before an exercise plan is laid out. Although the nurse does not prescribe an exercise program for the client, a sedentary lifestyle should not be recommended. A 4-year-old has been scheduled for a cardiac catheterization to help prepare the family. The nurse should 1. Advise the family to bring the child to the hospital for a tour a week in advance. 2. Explain that the child will need a large bandage after the procedure. 3. Discourage bringing favorite toys that might become associated with pain. 4. Explain that the child may get up as soon as the vital signs are stable. The correct answer is 2. The catheter insertion site will be covered with a bandage. This is important for preschool children to know, as they are very concerned about bodily harm. The best time to prepare a preschool child for an invasive procedure is the night before. Bringing a favorite toy to the hospital will help decrease the child's anxiety. To prevent bleeding, the child will be expected to keep the extremity straight for 4 to 6 hours after the procedure, either in bed or on the parent's lap. The nurse administers theophylline to a client. When evaluating the effectiveness of this medication, the nurse should assess the client for which of the following? 1. Suppression of the client's respiratory infection. 2. Decrease in bronchial secretions. 3. Less difficulty breathing. 4. Thinning of tenacious, purulent sputum. The correct answer is 3. Theophylline is a bronchodilator that is administered to relax airways and decrease dyspnea. Theophylline is not used to treat infections and does not decrease or thin secretions. A client who has undergone a mitral valve replacement has persistent bleeding from a sternal incision during the early postoperative period. The nurse should do which of the following? Select all that apply. 1. Administer warfarin. 2. Check the postoperative CBC, INR, PTT, and platelet levels. 3. Confirm availability of blood products. 4. Monitor the mediastinal chest tube drainage. 5. Start a dopamine drip for a systolic BP less than 100. The correct answers are 2, 3, and 4. The hemoglobin and hematocrit should be assessed to evaluate blood loss. An elevated INR and PTT and decreased platelet count increase the risk for bleeding. The client may require blood product depending on lab values and severity of bleeding. Therefore, availability of blood products should be confirmed by calling the blood bank. Close monitoring of blood loss from the mediastinal chest tubes should be done. Warfarin is an anticoagulant that will increase bleeding. Anticoagulation should be held at this time. Information is needed on the type of valve replacement. For mechanical heart valve, the INR is kept at 2 to 3.5. Tissue valves do not require anticoagulation. Dopamine should not be initiated if the client is hypotensive from hypovolemia. Fluid volume assessment should always be done first. Volume replacement should be initiated in a hypovolemic client prior to starting an inotrope, such as dopamine. An infant weighing 9 kilograms is in the pediatric intensive care unit following arterial switch surgery. In the past hour, the infant has had 16 milliliters of urine output. Which action should the nurse take? 1. Notify the primary healthcare provider immediately. 2. Record the urine output in the chart. 3. Administer a fluid bolus immediately. 4. Assess for other signs of hypervolemia. The correct answer is 2. Urine output for an infant weighing 9 kilograms should be 1 milliliter per kilogram per hour. 16 milliliters of urine output is more than adequate for 1 hour, so the nurse should record the output in the chart. There is no reason to notify the primary healthcare provider regarding adequate urine output. The infant has adequate output, so there is no need for a fluid bolus. A fluid bolus could also cause the infant to become fluid overloaded, increasing the workload on the heart. There is no information in the question indicating that the child is hypervolemic. Which of the following is an expected outcome for an adult client with well-controlled asthma? 1. Chest X-ray demonstrates minimal hyperinflation. 2. Temperature remains lower than 100 degrees Fahrenheit. 3. Arterial blood gas analysis demonstrates a decrease in PO2. 4. Breath sounds are clear. The correct answer is 4. Between attacks, breath sound should be clear on auscultation with good airflow present throughout lung fields. Chest X-rays should be normal. The client should remain afebrile. Arterial blood gases should be normal. When suctioning a tracheostomy tube 3 days following insertion, the nurse should follow which of the following procedures? 1. Use a sterile catheter each time the client is suctioned. 2. Clean the catheter in sterile water after each use and reuse for no longer than 8 hours. 3. Protect the catheter in sterile packaging between suctioning episodes. 4. Use a clean catheter with each suctioning and disinfect it in hydrogen peroxide between uses. The correct answer is 1. The recommended technique is to use a sterile catheter each time the client is suctioned. There is a danger of introducing organisms into the respiratory tract when strict aseptic technique is not used. Reusing a suction catheter is not consistent with aseptic technique. The nurse does not use a clean catheter when suctioning a tracheostomy or a laryngectomy. It is a sterile procedure. After instructing a premigravida client at 38 weeks gestation about how preeclampsia can affect the client and the growing fetus, the nurse realizes that the client needs additional instruction when she says that preeclampsia can lead to which of the following? 1. Hydrocephalic infant. 2. Abruptio placentae. 3. Intrauterine growth restriction. 4. Poor placental perfusion. The correct answer is 1. Congenital anomalies such as hydrocephalus are not associated with preeclampsia. Conditions such as stillbirth, prematurity, abruptio placentae, intrauterine growth restriction, and poor placental perfusion are associated with preeclampsia. Abruptio placentae occurs because of severe vasoconstriction. Intrauterine growth restriction is possible owing to poor placental perfusion. Poor placental perfusion results from increased vasoconstriction. The primary health care provider prescribes pulse assessments through the night for a 12-year-old child with rheumatic fever who has a daytime heart rate of 120. The nurse explains to the mother that this is to evaluate if the elevated heart rate is caused by 1. The morning digitalis, 2. Normal activity during waking hours, 3. A warmer daytime environment, 4. Normal variations in day and evening hours. The correct answer is 2. An above-average pulse rate that is out of proportion to the degree of activity is an early sign of heart failure in a client with rheumatic fever. The sleeping pulse is used to determine whether the mild tachycardia persists during sleep or whether it is a result of daytime activities. The environmental temperature would need to be quite warmer before it could influence the heart rate. Digitalis lowers the heart rate, so the rate would be decreased during the daytime. A 79-year-old client is admitted to the hospital with a diagnosis of bacterial pneumonia. While obtaining the client's health history, the nurse learns that the client has osteoarthritis, follows a vegetarian diet, and is very concerned with cleanliness. Which of the following would most likely be a predisposing factor for the diagnosis of pneumonia? 1. Age, 2. Osteoarthritis, 3. Vegetarian diet, 4. Daily bathing. The correct answer is 1. The client's age is a predisposing factor for pneumonia. Pneumonia is more common in elderly or debilitated clients. Other predisposing factors include smoking, upper respiratory tract infections, malnutrition, immunosuppression, and the presence of a chronic illness. Osteoarthritis, a nutritionally sound vegetarian diet, and frequent bathing are not predisposing factors for pneumonia. Soon after admission of a preemie-gravida client at 38 weeks gestation with severe preeclampsia, the primary healthcare provider prescribes a continuous intravenous infusion of 5% dextrose in Ringer solution and 4 grams of magnesium sulfate while the medication is being administered. Which of the following assessment findings should the nurse report immediately? 1. Respiratory rate of 11 breaths per minute. 2. Patellar reflex of +2. 3. Blood pressure of 160/88. 4. Urinary output exceeding intake. The correct answer is 1. A respiratory rate of 11 breaths per minute suggests potential respiratory depression, an adverse effect of magnesium sulfate therapy. The medication must be stopped, and the primary healthcare provider should be notified immediately. A patellar reflex of +2 is normal. Absence of patellar reflex suggests magnesium toxicity. A blood pressure reading of 160/88 would be a common finding in a client with severe preeclampsia. Urinary output exceeding intake is not likely in a client receiving intravenous magnesium sulfate. Oliguria is more common. Following an eclamptic seizure, the nurse should assess the client for which of the following? 1. Polyuria, 2. Facial flushing, 3. Hypotension, 4. Uterine contractions. The correct answer is 4. After an eclamptic seizure, the client commonly falls into a deep sleep or coma. The nurse must continually monitor the client for signs of impending labor, because the client will not be able to verbalize that contractions are occurring. Oliguria is more common than polyuria after an eclamptic seizure. Facial flushing is not common unless it is caused by a reaction to a medication. Typically, the client remains hypertensive unless medications, such as magnesium sulfate, are administered. After instructing a multigravida client at 10 weeks gestation diagnosed with chronic hypertension about the need for frequent prenatal visits, the nurse determines that the instructions have been successful when the client states which of the following? 1. I may develop hyperthyroidism because of my high blood pressure. 2. I need close monitoring because I may have a small for gestational age infant. 3. It's possible that I will have excess amniotic fluid and may need a cesarean section. For I may develop placenta accreta, so I need to keep my clinic appointments. The correct answer is 2. Women with chronic hypertension during pregnancy are at risk for complications such as preeclampsia, about 25%, abruptio placentae, and intrauterine growth retardation, resulting in a small for gestational age infant. There is no association between chronic hypertension and hyperthyroidism. Pregnant women with chronic hypertension are not at an increased risk for hydramnios, an abnormally large amount of amniotic fluid. Clients with diabetes and multiple gestations are at risk for this condition. Placenta accreta, a rare placental abnormality, refers to a condition in which the placenta abnormally adheres to the uterine lining. It is not associated with chronic hypertension. When caring for a multigravida client admitted to the hospital with vaginal bleeding at 38 weeks gestation, which of the following would the nurse anticipate administering intravenously if the client develops disseminated intravascular coagulation? 1. Ringer's lactate solution. 2. Fresh frozen platelets. 3. 5% dextrose solution. 4. Warfarin sodium. The correct answer is 2. Treatment of DIC includes treating the causative factor, replacing maternal coagulation factors, and supporting physiologic functions. Intravenous infusions of whole blood, fresh frozen plasma, or platelets are used to replace depleted maternal coagulation factors. Although Ringer's lactate solution and 5% dextrose solution may be used as intravenous fluid replacement, the client needs blood component therapy. Therefore, normal saline must be used. Intravenous heparin, not warfarin sodium, may be administered to halt the clotting cascade. The nurse who is caring for a client with kidney failure notes that the client is dyspneic, and crackles are heard on auscultation of the lungs. Which additional signs/symptoms should the nurse expect to note in this client? 1. Rapid weight loss. 2. Flat hand and neck veins. 3. A weak and thready pulse. 4. An increase in blood pressure. The correct answer is 4. Impaired cardiac or kidney function can result in fluid volume excess. Findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, an elevated blood pressure, a bounding pulse, an elevated central venous pressure, weight gain, edema, neck and hand vein distension, an altered level of consciousness, and a decreased hematocrit level. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. Police bring a client to the emergency department after she threatens to delete her ex-husband. She states emphatically, "The police should bring him in, not me. He's paranoid about my dating and has been stalking me for weeks. He's probably off his medicines. His case manager and the police won't do anything." In which order should the following nursing actions be done from first to last? 1. Ask about the marital problems leading to the divorce. 2. Assess the client's risk for harm to self and others. 3. Obtain the name of her ex-husband's case manager. 4. Interview the client about her current needs and situation. The correct order is 2, 4, 3, 1. The nurse should first assess the client's risk for harm, especially because the client could direct her anger toward her ex-husband or the nurse. Then it is important to know more about her current situation and her immediate needs. Obtaining information from the ex-husband's case manager might help clarify the risk of harm to the client. Problems leading to the divorce are less important than the situation following the divorce. When conducting a mental status examination with a newly admitted client who has an Axis-I diagnosis of paranoid schizophrenia, the client states, "I'm being followed. It's not safe. They're monitoring my every move." In which of the following areas of the mental status examination should the nurse document this information? 1. Thought content. 2. Quality of speech. 3. Insight. 4. Judgment. The correct answer is 1. The client is voicing paranoid delusions of being followed and monitored. Presence of delusions is described in the area of thought content in the mental status examination. The speech section would typically include documentation of disturbances in speech or pressured speech. In the insight section, the nurse would document information reflecting a lack of insight. For example, statements such as, "I don't have a problem." In the judgment section, the nurse would document information reflecting a lack of judgment. For example, poor choices such as buying a gun for self-protection. A pregnant client in her third trimester is started on chlorpromazine 25 milligrams 4 times daily. Which of the following instructions is most important for the nurse to include in the client's teaching plan? 1. Don't drive because there's a possibility of seizures occurring. 2. Avoid going out in the sun without a sunscreen with sun protection factor of 25. 3. Stop the medication immediately if constipation occurs. 4. Tell your doctor if you experience an increase in blood pressure. The correct answer is 2. Chlorpromazine is a low-potency antipsychotic that is likely to cause sun-sensitive skin. Therefore, the client needs instructions about using sunscreen with sun protection factor 25 or higher. Typically, chlorpromazine is not associated with an increased risk of seizures. Although constipation is a common adverse effect of this drug, it can be managed with diet, fluids, and exercise. The drug does not need to be discontinued. Chlorpromazine is associated with postural hypotension, not hypertension. Additionally, if postural hypotension occurs, safety measures, such as changing position slowly and dangling the feet before rising, not stopping the drug, are instituted. An outpatient client who has a history of paranoid schizophrenia and chronic alcohol dependency has been taking risperidone for several months. She reports that she stopped drinking 4 days ago. The client is very frightened by the tactile hallucinations of bugs crawling under her skin. Which of the following factors should the nurse incorporate into plan of care when explaining the tactile hallucinations? 1. Alcohol intoxication. 2. Ineffectiveness of risperidone. 3. Alcohol withdrawal. 4. Interaction of alcohol and risperidone. The correct answer is 3. Tactile hallucinations are more common in alcohol withdrawal than in schizophrenia. Therefore, the nurse should explain that these hallucinations are the result of withdrawal from alcohol. Because the client stopped drinking 4 days ago, the client is not intoxicated. Risperidone has little effect on symptoms of alcohol withdrawal. It is prescribed for symptoms of schizophrenia. Alcohol and risperidone have an additive effect, not one of causing hallucinations. A client who is suspicious of others, including staff, is brought to the hospital wearing a wrinkled dress with stains on the front. Assessment also reveals a flat effect, confusion, and slow movements. Which goal should the nurse identify as the initial priority when planning this client's care? 1. Helping the client feel safe and accepted. 2. Introducing the client to other clients. 3. Giving the client information about the program. 4. Providing the client with clean, comfortable clothes. The correct answer is 1. The initial priority for this client is to help her overcome suspiciousness of others, including staff, and thereby feel safe and accepted. Introducing the client to others, giving the client information about the program, and providing clean clothes are important, but these are of lower priority than helping the client feel safe and accepted. As hospital-based care has become more oriented to crisis intervention, criteria for admission to the hospital have also changed. Which clients have priority for admission to an acute care facility? Select all that apply. 1. Clients who live alone. 2. Clients who are acutely psychotic. 3. Clients who are acutely depressed. 4. Clients who are dangerous to self or others. 5. Clients who are not sleeping and have a lack of appetite. 6. Clients who are not complying with medication regimens. The correct answers are 2 and 4. Safety issues, including protection of the client and others, are the priorities for admission. Acute psychosis commonly involves issues of safety. Living alone is not a sufficient reason to be admitted to a healthcare facility. Depression, insomnia, lack of appetite, and noncompliance are important issues, but not sufficient for admission unless combined with one of the other criteria. The nurse is assessing a client with chronic heart failure who is demonstrating neurohormonal compensatory mechanisms. Which of the following are expected findings on assessment? Select all that apply. 1. Decreased cardiac output. 2. Increased heart rate. 3. Vasoconstriction in skin, GI tract, and kidneys. 4. Decreased pulmonary perfusion. 5. Fluid overload. The correct answers are 1, 2, 3, and 5. Heart failure can be a result of several cardiovascular conditions, which will affect the heart's ability to pump effectively. The body attempts to compensate through several neurohormonal mechanisms. Decreased cardiac output stimulates the aortic and carotid baroreceptors, which activates the sympathetic nervous system to release norepinephrine and epinephrine. This early response increases the heart rate and contractility. It also has some negative effects, including vasoconstriction of the skin, GI tract, and kidneys. Decreased renal perfusion due to low CO and vasoconstriction activates the renin-angiotensin-aldosterone process, resulting in the release of antidiuretic hormone. This causes fluid retention in an attempt to increase blood pressure, therefore cardiac output. In the damaged heart, this causes fluid overload. There is no parasympathetic response. Decreased pulmonary perfusion can be a result of fluid overload or concomitant pulmonary disease. The nurse is reading the results of a tuberculin skin test. See the picture on the screen. The nurse should interpret the results as 1. Negative, 2. Needing to be repeated, 3. Positive, 4. False. The correct answer is 3. The tuberculin test is positive. The test should be interpreted 2 to 3 days after administering the purified protein derivative, PPD, by measuring the size of the firm raised area in duration. Positive responses indicate that the client may have been exposed to the tuberculosis bacteria. A negative response is indicated by the absence of a firm raised area or an area that is less than 5 millimeters in diameter. Since the test is positive, it is not necessary to redo the test. The test is positive, not false. When developing a discharge plan to manage the care of a client with chronic obstructive pulmonary disease, the nurse should advise the client to expect to 1. Develop respiratory infections easily. 2. Maintain current status. 3. Require less supplemental oxygen. 4. Show permanent improvement. The correct answer is 1. A client with COPD is at high risk for development of respiratory infections. COPD is slowly progressive. Therefore, maintaining current status and establishing a goal that the client will require less supplemental oxygen are unrealistic expectations. Treatment may slow progression of the disease, but permanent improvement is highly unlikely. A client receiving a loop diuretic should be encouraged to eat which of the following foods? Select all that apply. 1. Angel food cake. 2. Banana. 3. Dried fruit. 4. Orange juice. 5. Peppers. The correct answers are 2, 3, and 4. Hypokalemia is a side effect of loop diuretics. Bananas, dried fruit, and oranges are examples of food high in potassium. Angel food cake, yellow cake, and peppers are low in potassium. A client who has been diagnosed with tuberculosis has been placed on drug therapy. The medication regimen includes rifampin. Which of the following instructions should the nurse include in the client's teaching plan related to the potential adverse effects of rifampin? Select all that apply. 1. Having eye examinations every 6 months. 2. Maintaining follow-up monitoring of liver enzymes. 3. Decreasing protein intake in the diet. 4. Avoiding alcohol intake. 5. The urine may have an orange color. The correct answers are 2, 4, and 5. A potential adverse effect of rifampin is hepatotoxicity. Clients should be instructed to avoid alcohol intake while taking rifampin and keep follow-up appointments for periodic monitoring of liver enzyme levels to detect liver toxicity. Rifampin causes the urine to turn an orange color, and the client should understand that this is normal. It is not necessary to restrict protein intake in the diet or have the eyes examined due to rifampin therapy. The nurse assesses the respiratory status of a client who is experiencing an exacerbation of chronic obstructive pulmonary disease secondary to an upper respiratory tract infection. Which of the following findings would be expected? 1. Normal breath sounds. 2. Prolonged inspiration. 3. Normal chest movement. 4. Coarse crackles and rhonchi. The correct answer is 4. Exacerbations of COPD are commonly caused by respiratory infections. Coarse crackles and rhonchi will be auscultated as air moves through airways obstructed with secretions. In COPD, breath sounds are diminished because of an enlarged anteroposterior diameter of the chest. Expiration, not inspiration, becomes prolonged. Chest movement is decreased as lungs become overdistended. A pulmonary artery catheter is inserted in a client with severe mitral stenosis and regurgitation. The nurse administers furosemide, Lasix, to treat pulmonary congestion and begins a nitroprusside, nipride, drip per physician prescriptions. The nurse notices a sudden drop in the pulmonary artery diastolic pressure and pulmonary artery wedge pressure. The nurse should first assess 1. 12-lead EKG. 2. Blood pressure. 3. Lung sounds. 4. Urine output. The correct answer is 2. The nurse should immediately assess the blood pressure since nipride and Lasix can cause severe hypotension from a decrease in preload and afterload. If the client is hypotensive, the nipride dose should be reduced or discontinued. Urine output should then be monitored to make sure there is adequate renal perfusion. A 12-lead EKG is performed if the client experiences chest pain. A reduction in pulmonary artery pressures should improve the pulmonary congestion and lung sounds. When teaching a preschool-age child how to perform coughing and deep breathing exercises before corrective surgery for tetralogy of Fallot, which of the following teaching and learning principles should the nurse address first? 1. Organizing information to be taught in a logical sequence. 2. Arranging to use actual equipment for demonstrations. 3. Building the teaching on the child's current level of knowledge. 4. Presenting the information in order from simplest to most complex. The correct answer is 3. Before developing any teaching program for a child, the nurse's first step is to assess the child to determine what is already known. Most older preschool children have some understanding of a condition present since birth. However, the child's interest will soon be lost if familiar material is repeated too often. The nurse can then organize the information in a sequence because there are several steps to be demonstrated. These exercises do not require the use of equipment. The nurse should judge the amount and complexity of the information to be provided based on the child's current knowledge and response to teaching. A client is prescribed metoprolol via a meter-dose inhaler, 2 puffs every 4 hours. The nurse instructs the client to report adverse effects. Which of the following are potential adverse effects of metoprolol? 1. Irregular heartbeat. 2. Constipation. 3. Pedal edema. 4. Decreased pulse rate. The correct answer is 1. Irregular heartbeat should be reported promptly to the care provider. Metoprolol may cause irregular heartbeat, tachycardia, or inguinal pain because of its adrenergic effect on beta-adrenergic receptors in the heart. It is not recommended for use in clients with known cardiac disorders. Metoprolol does not cause constipation, pedal edema, or bradycardia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Postoperative nursing management of the client following a radical neck dissection for laryngeal cancer requires 1. Complete bed rest minimizing head movement. 2. Vital signs once a shift. 3. Clear liquid diet started at 48 hours. 4. Frequent suctioning of the laryngectomy tube. The correct answer is 4. The nurse must maintain patency of the airway with frequent suctioning of the laryngectomy tube that can become occluded from secretions, blood, and mucus plugs. Once the client is hemodynamically stable, getting out of bed should be encouraged to prevent postoperative complications. Vital signs should be monitored more frequently in a postoperative client. A swallow study is done at approximately 5 to 7 days after surgery, prior to starting oral intake. The nurse is instructing a pre-eclamptic client about monitoring the movements of her fetus to determine fetal well-being, which statement by the client indicates that she needs further instruction about when to call the healthcare provider concerning fetal movement. 1. If the fetus is becoming less active than before. 2. If it takes longer each day for the fetus to move 10 times. 3. If the fetus stops moving for 12 hours. 4. If the fetus moves more often than 3 times an hour. The correct answer is 4. The fetus is considered well if it moves more often than 3 times in 1 hour. Daily fetal movement counting is part of all high-risk assessments and is a non-invasive, inexpensive method of monitoring fetal well-being. The healthcare provider should be notified if there's a gradual slowing over time of fetal activity, if each day it takes longer for the fetus to move a minimum of 10 times, or the fetus stops moving for 12 hours or longer. A 12-year-old with rheumatic fever has a history of long-term aspirin use, which statement by the client indicates that the nurse should notify the healthcare provider. 1. I hear ringing in my ears. 2. I put lotion on my itchy skin. 3. My stomach hurts after I take that medicine. 4. These pills make me cough. The correct answer is 1. Tinnitus is an adverse effect of prolonged aspirin therapy, and the child should be examined by a healthcare provider for hearing loss. Itchy skin commonly accompanies a rash associated with rheumatic fever, and the nurse can encourage lotion use. The nurse teaches clients to take aspirin with food or milk to avoid abdominal discomfort. The nurse can also address the fact that coughing after ingesting aspirin can be caused by inadequate fluid intake during administration. Which of the following home care instructions would be appropriate for a client with a laryngectomy? 1. Perform mouth care every morning and evening. 2. Provide adequate humidity in the home. 3. Maintain a soft, bland diet. 4. Limit physical activity to shoulder and neck exercises. The correct answer is 2. Adequate humidity should be provided in the home to help keep secretions moist. A bedside humidifier is recommended. A high fluid intake is also important to liquefy secretions. Mouth care is important to prevent drying of mucous membranes and should be performed frequently throughout the day, especially before and after meals, to help stimulate appetite. The client may eat any food that can be chewed and swallowed comfortably. The client may resume physical activity as tolerated. For the client who is receiving intravenous magnesium sulfate for severe preeclampsia, which the following assessment findings would alert the nurse to suspect hypermagnesemia. 1. Decreased deep tendon reflexes. 2. Cool skin temperature. 3. Rapid pulse rate. 4. Tingling in the toes. The correct answer is 1. Typical signs of hypermagnesemia include decreased deep tendon reflexes, sweating or flushing of the skin, oliguria, decreased respirations, and lethargy progress into coma as the toxicity increases. The nurse should check the client's patellar, biceps, and radial reflexes regularly during magnesium sulfate therapy. Cool skin temperature may result from peripheral vasodilation, but the opposite, flushing and sweating, are usually seen. A rapid pulse rate commonly occurs in hypomagnesemia. Tingling in the toes may suggest hypocalcemia, not hypermagnesemia. A client with pneumonia has a temperature of 102.6 degrees Fahrenheit, is diaphoretic, and has a productive cough. The nurse should include which of the following measures in the plan of care? 1. Position changes every 4 hours. 2. Nasotracheal suctioning to clear secretions. 3. Frequent linen changes. 4. Frequent offering of a bedpan. The correct answer is 3. Frequent linen changes are appropriate for this client because of the diaphoresis. Diaphoresis produces general discomfort. The client should be kept dry to promote comfort. Position changes need to be done every 2 hours. Nasotracheal suctioning is not indicated with the client's productive cough. Frequent offering of a bedpan is not indicated by the data provided in the scenario. The nurse administers 2 325 milligrams aspirin every 4 hours to a client with pneumonia. The nurse should evaluate the outcome of administering the drug by assessing which of the following. Select all that apply. 1. Decrease pain when breathing. 2. Prolonged clotting time. 3. Decreased temperature. 4. Decreased respiratory rate. 5. Increased ability to expectorate secretions. The correct answers are 1 and 3. Aspirin is administered to clients with pneumonia because it is an analgesic that helps control chest discomfort and an antipyretic that helps reduce fever. Aspirin has an anticoagulant effect, but that is not the reason for prescribing it for a client with pneumonia, and the use of the drug will be short-term. Aspirin does not affect the respiratory rate and does not facilitate expectoration of secretions. The nurse is inspecting the child's throat. The nurse should 1. Remove the tongue blade from the child's hands after he has experienced what it feels like in his mouth. 2. Ask the child to hold the tongue blade with both hands in his lap while the nurse uses another tongue blade. 3. Have the parent hold the child with arms restrained. 4. Guide the tongue blade while the child is holding it to depress the tongue to visualize the throat. The correct answer is 4. If the child does not stick out his tongue so the nurse can visualize the throat, it is appropriate to use a tongue blade. Having the child participate by holding the tongue blade while the nurse guides it to facilitate visualization of the throat is appropriate technique. It is not useful to remove the tongue blade or have the child hold it because the nurse will need to use the tongue blade to depress the tongue. It is preferable to engage the child's cooperation before asking the parent to restrain the child. An adolescent female is prescribed amoxicillin, Amoxil, for an ear infection. The nurse should teach the adolescent about the risks associated with her concurrent use of 1. Antacids, 2. Oral contraceptives, 3. Multiple vitamins, 4. Protein shakes. The correct answer is 2. When a person is taking amoxicillin as well as an oral contraceptive, it renders the contraceptive less effective. Because pregnancy can occur in such a situation, the nurse should advise the client to use additional means of birth control during the time she is taking the antibiotic. There are no risks associated with the concurrent use of amoxicillin and antacids, vitamins, or protein shakes. After teaching the parents of an 18-month-old who was treated for a foreign body obstruction about the 3 cardinal signs indicative of choking, the nurse determines that the teaching has been successful when the parents state that a child is choking when he or she cannot speak, turns blue, and does which of the following? 1. Vomits, 2. Gasps, 3. Gags, 4. Collapses. The correct answer is 4. The 3 cardinal signs indicating that a child is truly choking and requires immediate life-saving interventions include inability to speak, blue color, and collapse. Vomiting does not occur while a child is unable to breathe. Once the object is dislodged, however, vomiting may occur. Gasping, a sudden intake of air, indicates that the child is still able to inhale. When a child is choking, air is not being exchanged, so gagging will not occur. A woman with asthma controlled through consistent use of medication is now pregnant for the first time. Which of the following client statements concerning asthma during pregnancy indicates the need for further instruction? 1. I need to continue taking my asthma medication as prescribed. 2. It is my goal to prevent or limit asthma attacks. 3. During an asthma attack, oxygen needs to continue to be high for mother and fetus. 4. Bronchodilators should be used only when necessary because of the risk they present to the fetus. The correct answer is 4. Asthma medications and bronchodilators should be continued during pregnancy as prescribed before the pregnancy began. The medications do not cause harm to the mother or fetus. Regular use of asthma medication will usually prevent asthma attacks. Prevention and limitation of an asthma attack is the goal of care for a client who is or is not pregnant and is the appropriate care strategy. During an asthma attack, oxygen needs continue as with any pregnant client, but the airways are edematous, decreasing perfusion. Asthma exacerbations during pregnancy may occur as a result of infrequent use of medication rather than as a result of the pregnancy. A dilatation and curettage is scheduled for a premigravida client admitted to the hospital at 10 weeks gestation with abdominal cramping, bright red vaginal spotting, and passage of some of the product of conception. The nurse should assess the client further for the expression of which of the following feelings? 1. Ambivalence. 2. Anxiety. 3. Fear. 4. Guilt. The correct answer is 4. With a spontaneous abortion, many clients and their partners feel an acute sense of loss. Their grieving commonly includes feelings of guilt, which may be expressed as wondering whether the woman could have done something to prevent the loss. Anger, sadness, and disappointment are also common emotions after a pregnancy loss. Ambivalence, anxiety, and fear are not common emotions after a spontaneous abortion. While caring for a 24-year-old premigravida client scheduled for emergency surgery because of a probable ectopic pregnancy, the nurse should 1. Prepare to witness and inform consent for surgery. 2. Assess the client for massive external bleeding. 3. Explain that the fallopian tube can be salvaged. 4. Monitor the client for uterine contractions. The correct answer is 1. The client may need surgery to remove a ruptured fallopian tube where the pregnancy has occurred, and the nurse is usually responsible for witnessing the signature on informed consent. Typically, if bleeding is occurring, it is internal, and there is only scant vaginal bleeding with no discoloration. The nurse cannot determine whether the fallopian tube can be salvaged. This can be accomplished only during surgery. If the tube has ruptured, it must be removed. If the tube has not ruptured, a linear salpingostomy may be done to salvage the tube for future pregnancies. With an ectopic pregnancy, although the client is experiencing abdominal pain, she is not having uterine contractions. A healthcare provider has prescribed valproic acid for a client with bipolar disorder who has achieved limited success with lithium carbonate. The nurse should instruct the client about which of the following? 1. Follow-up blood tests are necessary while on this medication. 2. The extended release tablet can be crushed if necessary for ease of swallowing. 3. Tachycardia and upset stomach are common side effects. 4. Consumption of a moderate amount of alcohol is safe if the medication is taken in the morning. The correct answer is 1. Valproic acid can cause hepatotoxicity, so regular liver function tests are needed. Other side effects include nausea and drowsiness. Extended release tablets should not be split or crushed. Doing so changes their absorption. Alcohol should never be mixed with this medication. There will be medication in the client's body at all times. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client with acute mania fails to respond to a nurse's interventions to decrease his agitation. The nurse has attempted to defuse the client's anger, but the client refuses to participate in interventions that would lower anxiety. Which action should the nurse take next? 1. Seclude the client. 2. Restrain the client. 3. Medicate the client. 4. Control the client. The correct answer is 3. The nurse should medicate the client who does not respond to verbal interventions and whose anxiety is escalating. This will reduce the client's anxiety and agitation and prevent harm or injury to the client and others. Seclusion, restraint, and controlling the client are a last resort and require a primary healthcare provider prescription and close assessment for when the prescriptions can be discontinued. The nurse should assess the client with left-sided heart failure, for which the following? Select all that apply. 1. Dyspnea. 2. Jugular vein distension. 3. Crackles. 4. Right upper quadrant pain. 5. Oliguria. 6. Decreased oxygen saturation levels. The correct answers are 1, 3, 5, and 6. Dyspnea, crackles, oliguria, and decreased oxygen saturation are signs and symptoms related to pulmonary congestion and inadequate tissue perfusion associated with left-sided heart failure. JVD and right upper quadrant pain, along with ascites and edema, are usually associated with congestion of the peripheral tissues and viscera in right-sided heart failure. The nurse should teach clients that the most common route of transmitting tubercle bacilli from person to person is through contaminated 1. Dust particles, 2. Droplet nuclei, 3. Water, 4. Eating utensils. The correct answer is 2. Tubercle bacilli are spread by airborne droplet nuclei. Droplet nuclei are the residue of evaporated droplets containing the bacilli, which remain suspended and are circulated in the air. Dust particles and water do not spread tubercle bacilli. Tuberculosis is not spread by eating utensils, dishes, or other fomites. When planning care for a client with schizophrenia who lacks motivation to shower and dress, which of the following outcomes should the nurse expect the client to achieve by the end of 4 days? 1. Verbalize the need to shower and dress herself. 2. Recognize the need to shower and dress herself. 3. Explain reasons for showering and dressing herself. 4. Perform showering and dressing for herself. The correct answer is 4. By the end of 4 days, the client should be able to perform showering and dressing for herself. The client with schizophrenia commonly appears to be apathetic and lack initiative. Therefore, demonstrating the ability to complete the tasks indicates improvement. Although the client may be able to recognize, verbalize, or explain the need to shower and dress herself, she may be unable to do so because of the ambivalence associated with schizophrenia that impedes the client's ability to initiate and complete self-care. Therefore, evidence of improvement would be lacking. The nurse should teach the client that signs of digoxin toxicity include which of the following? 1. Rash over the chest and back. 2. Increased appetite. 3. Visual disturbances, such as seeing yellow spots. 4. Elevated blood pressure. The correct answer is 3. Colored vision and seeing yellow spots are symptoms of digoxin toxicity. Abdominal pain, anorexia, nausea, and vomiting are other common symptoms of digoxin toxicity. Additional signs of toxicity include arrhythmias, such as atrial fibrillation or bradycardia. Rash, increased appetite, and elevated blood pressure are not associated with digoxin toxicity. The nurse should caution sexually active female clients taking isoniazid, INH, that the drug has which of the following effects? 1. Increases the risk of vaginal infection. 2. Has mutagenic effects on ova. 3. Decreases the effectiveness of hormonal contraceptives. 4. Inhibits ovulation. The correct answer is 3. INH interferes with the effectiveness of hormonal contraceptives, and female clients of childbearing age should be counseled to use an alternative form of birth control while taking the drug. INH does not increase the risk of vaginal infection, nor does it affect the ova or ovulation. A client's arterial blood gas values are as follows: pH 7.31, PaO2 80 millimeters of mercury, PaCO2 65, HCO3 36 milliequivalents per liter. The nurse should assess the client for 1. Cyanosis, 2. Flushed skin, 3. Irritability, 4. Anxiety. The correct answer is 2. The high PaCO2 level causes flushing due to vasodilation. The client also becomes drowsy and lethargic because carbon dioxide has a depressant effect on the central nervous system. Cyanosis is a sign of hypoxia. Irritability and anxiety are not common with a PaCO2 level of 65, but are associated with hypoxia. A client is scheduled for a cardiac catheterization. The nurse should do which of the following pre-procedure tasks? Select all that apply. 1. Administer all prescribed oral medications. 2. Check for iodine sensitivity. 3. Verify that written consent has been obtained. 4. Withhold food and oral fluids before the procedure. 5. Insert a urinary drainage catheter. The correct answers are 2, 3, and 4. For clients scheduled for a cardiac catheterization, it is important to assess for iodine sensitivity, verify written consent, and instruct the client to take nothing by mouth for 6 to 18 hours before the procedure. Oral medications are withheld unless specifically prescribed. A urinary drainage catheter is rarely required for this procedure. An 18-month-old with congenital heart defect is to receive digoxin twice a day. The nurse should instruct the parents about which of the following? 1. Digoxin enables the heart to pump more effectively with a slower and more regular rhythm. 2. Signs of toxicity include loss of appetite, vomiting, increased pulse, and visual disturbances. 3. Digoxin is absorbed better if taken with meals. 4. If the child vomits within 15 minutes of administration, the dosage should be repeated. The correct answer is 1. Digoxin's effect is to slow the rate of the electrical conduction to the heart and increase the strength of the heart's contraction. Signs of toxicity include anorexia and decreased heart rate. Digoxin should be taken 1 hour before meals or 2 hours after meals in order to obtain better absorption of the drug. If the child vomits within 15 minutes of administration, the dose should not be repeated because it is not known how much of the medication has been absorbed. A client experiencing a severe asthma attack has the following arterial blood gas results: pH 7.33, PCO2, 48 PO2, 58 HCO3, 26. Which of the following prescriptions should the nurse perform first? 1. Albuterol nebulizer. 2. Chest X-ray. 3. Ipratropium inhaler. 4. Sputum culture. The correct answer is 1. The arterial blood gas reveals a respiratory acidosis with hypoxia. A quick-acting bronchodilator, albuterol, should be administered via nebulizer to improve gas exchange. Ipratropium is a maintenance treatment for bronchospasm that can be used with albuterol. A chest X-ray and sputum sample can be obtained once the client is stable. Good dental care is an important measure in reducing the risk of endocarditis. A teaching plan to promote good dental care in a client with mitral stenosis should include instructing the client to do which of the following? Select all that apply. 1. Brush the teeth at least twice a day. 2. Avoid use of an electric toothbrush. 3. Take an antibiotic prior to oral surgery. 4. Floss the teeth at least once a day. 5. Have regular dental checkups. 6. Rinse the mouth with an antibiotic mouthwash once a day. The correct answers are 1, 4, and 5. Daily dental care, including brushing the teeth twice a day and flossing once a day, and frequent checkups by a dentist who is informed about the client's condition, are required to maintain good oral health. The client can use a regular toothbrush. It is not necessary to avoid use of an electric toothbrush. Taking antibiotics prior to certain dental procedures is recommended only if the client has a prosthetic valve or a heart transplant. It is not necessary to use an antibiotic mouthwash. The mother of a child hospitalized with tetralogy of Fallot tells the nurse that the child's 3-year-old sibling has become quiet and shy and demonstrates more than a usual amount of genital curiosity since this child's hospitalization. The nurse should tell the mother, 1. This behavior is very typical for a 3-year-old. 2. This may be how your child expresses feeling a need for attention. 3. This may be an indication that your child might feel responsible. 4. This may be a sign of depression in your child. The correct answer is 2. According to Erickson, the central psychosocial task of a preschooler is to develop a sense of industry versus guilt. Any environmental situation may affect the child. In this situation, the sibling is probably feeling less attention from the mother and trying to resolve the conflict in an inappropriate way. 3-year-olds are usually active and outgoing. These behaviors represent a change. Symptoms of depression would include withdrawal and fatigue. A client diagnosed with asthma has been prescribed fluticasone 1 puff every 12 hours per inhaler. Place in correct order the statements the nurse would use when teaching the client how to properly use the inhaler with a spacer. 1. Hold your breath for at least 10 seconds, then breathe in and out slowly. 2. Take off the cap and shake the inhaler. 3. Rinse your mouth. 4. Breathe out all of your air. Hold the mouthpiece of your inhaler and spacer between your teeth with your lips closed around it. 5. Press down on the inhaler once and breathe in slowly. 6. Attach the spacer. The correct order is 2, 6, 4, 5, 1, and 3. Using a spacer, especially with an inhaled corticosteroid, can make it easier for medication to reach the lungs. It can also prevent excess medication remaining in the mouth and throat, where it can lead to minor irritation. It is important for the client to empty the lungs, breathe in slowly, and hold breath in order to draw as much medication into the lungs as possible. Rinsing after using a corticosteroid inhaler may help prevent irritation and infection. Rinsing will also reduce the amount of drug swallowed and absorbed systemically. A client has had hoarseness for more than 2 weeks. The nurse should 1. Refer the client to a healthcare provider for a prescription for an antibiotic. 2. Instruct the client to gargle with salt water at home. 3. Assess the client for dysphagia. 4. Instruct the client to take a throat analgesic. The correct answer is 3. Hoarseness occurring longer than 2 weeks is a warning sign of laryngeal cancer. The nurse should first assess other signs, such as a lump in the neck or throat, persistent sore throat or cough, earache, pain, and difficulty swallowing. Gargling with salt water may lead to increased irritation. There is no indication of infection warranting an antibiotic. An oral analgesic will provide only temporary relief of discomfort if hoarseness is accompanied by a sore throat. A preemie gravida client at 38 weeks gestation diagnosed with mild preeclampsia calls the clinic nurse to say she has a continuous headache for the past 2 days accompanied by nausea. The client does not want to take aspirin. The nurse should tell the client, 1. Take 2 acetaminophen tablets. They aren't as likely to upset your stomach. 2. I think the doctor should see you today. Can you come to the clinic this morning? 3. You need to lie down and rest. Have you tried placing a cool compress over your head? 4. I'll ask the doctor to call in a prescription for aspirin with codeine. What's your pharmacy's number? The correct answer is 2. A client with preeclampsia and a continuous headache for 2 days should be seen by a healthcare provider immediately. Continuous headache, drowsiness, and mental confusion indicate poor cerebral perfusion and are symptoms of severe preeclampsia. Immediate care is recommended because these symptoms may lead to eclampsia or seizures if left untreated. Advising the client to take 2 acetaminophen tablets would be inappropriate and may lead to further complications if the client is not evaluated and treated. Although the application of cool compresses may ease the pain temporarily, this would delay treatment. Aspirin with codeine may temporarily relieve the client's headache. However, this delays immediate treatment, which is crucial. Additionally, pregnant women are advised not to take aspirin at this time because it may cause clotting problems in the neonate. Codeine generally is not prescribed. A 16-month-old child diagnosed with Kawasaki disease is very irritable, refuses to eat, and exhibits peeling skin on the hands and feet. The nurse should do which of the following first? 1. Apply lotion to the hands and feet. 2. Offer food the toddler likes. 3. Place the toddler in a quiet environment. 4. Encourage the parents to get some rest. The correct answer is 3. One of the characteristics of children with KD is irritability. They are often inconsolable. Placing the child in a quiet environment may help quiet the child and reduce the workload of the heart. Although peeling of the skin occurs with KD, the child's irritability takes priority over applying lotion to the hands and feet. Children with KD usually are not hungry and do not eat well regardless of what is served. There is no indication that the parents need rest. Additionally, in this situation, the child takes priority over the parents. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. As a nurse enters a room of a newly admitted premigravida client diagnosed with severe preeclampsia, the client begins to experience a seizure. Which of the following should the nurse do first? 1. Insert an airway to improve oxygenation. 2. Note the time when the seizure begins and ends. 3. Call for immediate assistance. 4. Turn the client to her left side. The correct answer is 3. If a client begins to have a seizure, the first action by the nurse is to remain with the client and call for immediate assistance. The nurse needs to have some assistance in managing this client. After the seizure, the client needs intensive monitoring. An airway can be inserted, if appropriate, after the seizure ends. Noting the time the seizure begins and ends and turning the client to her left side should be done after assistance is obtained. A client at 36 weeks gestation begins to exhibit signs of labor after an eclamptic seizure. The nurse should assess the client for 1. Abruptio placentae. 2. Transverse lie. 3. Placenta accreta. 4. Uterine atony. The correct answer is 1. After an eclamptic seizure, the client is at risk for abruptio placentae due to severe vasoconstriction resulting in hemorrhage into the decidua basalis. Abruptio placentae is manifested by a board-like abdomen and an abnormal fetal heart rate tracing. Transverse lie or shoulder presentation, placenta accreta, and uterine atony are not related to eclampsia. Causes of a transverse lie may include relaxation of the abdominal wall secondary to grand multiparity, preterm fetus, placenta previa, abnormal uterus, contracted pelvis, and excessive amniotic fluid. Placenta accreta, a rare phenomenon, refers to a condition in which the placenta abnormally adheres to the uterine lining. Uterine atony, or relaxed uterus, may occur after childbirth, leading to postpartum hemorrhage. A client presents to the OB triage unit with no prenatal care and painless bright red vaginal bleeding. Which interventions are most indicated? 1. Apply an external fetal monitor and complete physical assessment. 2. Applying external fetal monitor and perform sterile vaginal exam. 3. Obtaining a fundal height physical assessment on the patient. 4. Obtaining fundal height and a sterile vaginal exam. The correct answer is 1. Bright red vaginal bleeding without contractions could indicate a placenta previa. A sterile vaginal exam should never be done on a woman with a known or suspected placenta previa. Applying the external fetal monitor will allow the nurse to assess fetal status. A complete physical assessment of the patient is indicated. A fundal height is used to monitor fetal growth during pregnancy, but does not provide information related to vaginal bleeding. When assessing a 34-year-old multigravida client at 34 weeks gestation experiencing moderate vaginal bleeding, which would follow would most likely alert the nurse that placenta previa is present. 1. Painless vaginal bleeding. 2. Uterine tetany. 3. Intermittent pain with spotting. 4. Dull lower back pain. The correct answer is 1. The most common assessment finding associated with placenta previa is painless vaginal bleeding. With placenta previa, the placenta is abnormally implanted, covering a portion or all of the cervical OS. Uterine tetany, intermittent pain with spotting, and dull lower back pain are not associated with placenta previa. Uterine tetany is associated with oxytocin administration. Intermittent pain with spotting commonly is associated with spontaneous abortion. Dull lower back pain is commonly associated with poor maternal posture or a urinary tract infection with renal involvement. A young client diagnosed with paranoid schizophrenia is talking with a nurse. You know, when I thought everyone was out to get me, I was staying in my apartment all the time. Now, I'd like to get out and do things again. What is the best initial response by the nurse? 1. With whom do you want to do things? 2. What activities did you enjoy in the past? 3. What kind of transportation do you use? 4. How much money can you spend? The correct answer is 2. Knowing the client's interests is the best place to begin to help the client re-socialize. Knowing with whom the client wishes to socialize, what transportation she has, or how much spending money she has may be relevant questions. but should be asked after the question concerning what activities the client enjoyed in the past. A client who has been stabilized on medications for several months is at the clinic for a medication check. During conversation with a nurse, the client suddenly jumps up, begins pacing, and wrings her hands. In what order should the nurse do the following interventions from first to last? 1. Walk with the client to help decrease her anxiety. 2. Discuss productive ways to solve her problems causing anxiety. 3. Share observations about her anxiety-related behaviors. 4. Ask the client about the sources of her anxiety. The correct order is 1, 3, 4, 2. The nurse should first walk with the client to reduce her anxiety because the client must be at a mild level of anxiety before learning can occur. Sharing observations with the client conveys a sense of caring. Later, the nurse can help the client connect the anxiety-related behaviors to her feelings of anxiety. Once the client can identify the source of her anxiety, she can talk about solutions. The wife of a client diagnosed with paranoid schizophrenia visits 2 days after her husband's admission and states to the nurse, "Why isn't he eating? He's still talking about his food being poisoned." Which of the following appraisals by the nurse is most accurate? 1. The wife's inquiry is reasonable. 2. Education about her husband's medications is needed. 3. Her expectations of her husband are realistic. 4. An increase in the client's medication is indicated. The correct answer is 2. For the client with paranoid schizophrenia, 2 days on medication is too short a time for improvement to be seen. Therefore, the nurse evaluates the client's wife as needing education or knowledge about paranoid schizophrenia, the course of the illness, and medications. Expecting an absence of delusions by the end of the client's second day of hospitalization is unrealistic. Rather, the nurse would reasonably expect delusions to decrease, disappearing by 5 to 9 days of hospitalization. The wife's inquiry is not reasonable because not enough time has elapsed to evaluate the effectiveness of treatment. An increase in the client's medication would be unreasonable because not enough time has elapsed to evaluate the effectiveness of the medication. Generally, a time frame of 5 to 7 days is needed before the effectiveness of medications can be determined. A client reports that men in blue clothes keep looking in her window and talking about her. Which of the following responses by the nurse is most appropriate? 1. Those men are groundskeepers. They're talking about their work. Not you. 2. Don't take things so personally. Not everyone who is talking about you. 3. Let's not pay attention to men. Let's play cards instead. 4. I'll close the drapes so you can't see the men. The correct answer is 1. The nurse needs to present the reality of the situation. By explaining that the men are groundskeepers and probably talking about work, the nurse is reinforcing reality to counter the client's illusion. Additionally, this response voices doubt in the client's paranoid interpretation. Telling the client not to take things personally is flippant and judgmental. Telling the client to not pay attention to the men fails to address the client's misinterpretations and misperceptions. Closing the drapes so that the client doesn't see the men ignores the client's misperceptions and misinterpretation. The parent of a young adult client diagnosed with paranoid schizophrenia is asking questions about his son's antipsychotic medication, ziprasidone. Which of the following statements by the father reflects a need for further teaching? 1. If he experiences restlessness or muscle stiffness, he should tell the doctor. 2. I should give him benztropine to help prevent constipation from the ziprasidone. 3. If he becomes dizzy, I'll make sure he doesn't drive. 4. The ziprasidone should help him be more motivated and less withdrawn. The correct answer is 2. Constipation caused by medication is best managed by diet, fluids, and exercise. Benztropine can increase constipation. However, it may be prescribed for restlessness and stiffness. Restlessness and stiffness should be reported to the primary health care provider. Drowsiness and dizziness are adverse effects of ziprasidone. Clients should not drive if they are experiencing dizziness. Ziprasidone does help improve the negative symptoms of schizophrenia, such as avolition. A newly admitted client diagnosed with paranoid schizophrenia is pacing rapidly and wringing his hands. He states that another client is out to get him. Then he says, protect me, select me, reject me. The nurse should next 1. Administers oral PRN lorazepam and haloperidol. 2. Place the client in temporary seclusion before he has a chance to hurt others. 3. Call the primary healthcare provider for a prescription for restraints. 4. Ask the other clients to leave the immediate area. The correct answer is 1. The client anxiety, as reflected in rapid pacing and clang associations, is rising as a result of his paranoid delusions. Administering the lorazepam and haloperidol will help the anxiety and delusions. The client is not threatening others at this point, so seclusion, restraints, and asking clients to leave the area is not necessary. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.